Hello, welcome. My name is Sabrina Kurtz-Rossi, and I'd like to welcome you to What is Health Literacy, a health literacy micro-lecture. In this micro-lecture, I'm going to present a definition of health literacy as well as a conceptual framework for health literacy. I'd like to begin with the end. I always like to begin with the end to say that a key message of this micro-lecture is that health literacy is both a problem for the individual as well as society. It is influenced by both the skills and abilities of the individual as well as the skills and abilities of health communicators and the complexity of health organizations, health systems, and public health messaging. But we will return to this at the end of this lecture to really as a way of checking my teaching and also checking your learning. So to begin, let me ask you a question. What are the literacy demands in health and healthcare? In other words, what do we ask people to read, understand, and act on for their health? To access health information, to use a healthcare system? Let me begin with a list, or a list that I can think of off the top of my head. Let's say brochures and pamphlets about various health topics, thinking about health history forms or intake forms as people come in and receive services, medication labels and warnings. What about signage within healthcare systems? What about public health messaging? People need to read and understand those. What about instructions for preparation for procedures or discharge instructions? We rely a great deal on the printed word to communicate health information. I present here the most cited definition of health literacy. Health literacy, the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. This is a definition that is presented by the Department of Health and Human Services. It's cited in the Healthy People documents. It is, again, the most widely cited definition, basically talking about the ability to read information, understand that information, communicate information orally, but then be able to apply lessons learned to make health information decisions for oneself and one's family. This definition is recognized as having significant limitations. It really focuses on one side of the equation, which are the skills and the abilities of the individual. It does not recognize at all the skills and abilities of the communicator or the complexity of the healthcare system, nor does it recognize the influence that culture and language and the interplay between culture, language, and health literacy. So I'd like to present a broader conceptual framework, one in which very explicitly recognizes the influence that individual skills and abilities interacting with the complexity or the demands of the healthcare system as a broader framework for thinking about what is health literacy. Here is an even broader conceptual framework that really looks at both health literacy within the medical context as well as within a public health context. You can see on the left-hand side there is a recognition of the social determinants of health and the environmental determinants of health as well as the personal determinants of health. In the center of the circle you do have knowledge, but then around that you have the accessing health information, assessing health information, evaluating and applying. So those are the skills, but then those can be applied within a healthcare context, that can be applied for disease prevention as well as health promotion, so a much larger framework. There's also a recognition on the top that health literacy is a continuum along the life course, as well as a continuum that is on the individual level as well as on a population-based level. And ultimately on the right side you can see that there are influences of health literacy on accessing health services and healthcare costs, on individual behaviors and health outcomes, on engagement and empowerment, and participation and empowerment, as well as issues of equity and sustainability. So to focus in on those skills, this is another framework, another definition of health literacy, the Calgary Charter of Health Literacy, that looks at talks about not only the skills of the individual, but the skills of the health communicator, the health professional communicating that information. And the skills are to find information, to understand that information, to evaluate, to communicate, and then to use. And this applies to both the individual and the health profession. And really, communicate is that interactive piece of what is health literacy. But what is also offered in this framework are these constructs that also need to be in place to support those individual and systems skills. And those constructs include fundamental literacy, as well as scientific literacy, cultural literacy, and civic literacy. So in other words, any intervention that we want to see to address health literacy really needs to include these fundamental constructs in order to make a difference to those particular skills that we talk about. And then another, almost a theoretical model, theoretical construct, we're kind of moving in that direction as a field, is that we really need to be sure that any intervention to address health literacy includes functional health literacy, so basic skills, reading and writing, oral presentation skills, but then also a more higher level skills that include interactive health literacy. So that's really taking information and applying that to changing circumstances and using that information and those skills. But finally, there is the critical health literacy component, which really is a critical analysis and a use of new skills and information for social and political change. And I feel like this component is really what's going to make a difference in terms of the potential for health literacy to address health equity and to put us on the path to more equitable health and health care. I also like to say that health literacy is a fairly recent movement. It's in a field that's evolving. In the early years, 2004, 2007, we really looked at, we had some documents that looked specifically at research, looking at individual health literacy, and talking about improving, starting to improve systems. But then there were policy initiatives in 2010, the National Action Plan to improve health literacy in the U.S., as well as the Affordable Care Act. We really started moving into the realm of looking at systems when the attributes of a health literate healthcare organization were issued in 2012. And as well as the enhanced class standards, culturally and linguistically appropriate service standards. And these standards really do look at systems and organizations. And ultimately, or finally, I just need to raise your attention that there's the Shanghai Declaration on the role of health literacy in supporting sustainability and development. And this is of the World Health Organization in 26. So we've come a long way. All right, let's return to my key point, but first I'd like to ask you, what questions did this micro lecture raise for you? I mean, from my perspective, a key point is that health literacy and health literacy interventions must enhance skills, functional, interactive, critical, and reduce the complexity of at multiple levels. But I'd like to ask you to think about what are the key points or the takeaways from your perspective and that apply to your work and interests.